Hey guys, welcome to another day in the life video. I'm looking at some deliveries right now and I'm getting ready to code one. Let me see what this is. If this is vaginal or cesarean. And if it's my patient or not. Let's see here. She was seen by my provider on this day and my coworker's provider post-op. It is my delivery, so I'm going to go ahead and fill it out. I do have some missing charges that I have to enter for this patient. So I'm going to go ahead and enter those. Let's see what dates. Another one for the 13th. And I think that's it. So I have 1, 2, and then those ones are already there. Okay. So when I do deliveries, I like to, and I'm so sorry if my voice is low. It's 6 o'clock in the morning, so I really don't have a loud voice right now. But hopefully you guys can hear me. Let's see here. I like to do the post-op days or post-delivery days first before I do the delivery. And I do that because usually they will have any complications in the discharge summary of what happened in the delivery. So these are things for me to just keep an eye out when I'm reviewing that delivery note. So it says here she has second-degree laceration, a labial laceration, superficial perineal laceration, and she left on hospital day 2. So the diagnosis that I'm going to use for this discharge summary is the Z39.2, and I'm going to link it to my post-op code. And I'm finished with that one. I had another post-delivery day, which was the first day. And this one is another Z39.2. All right, and now I'm going to look at some of her progress notes before she delivered. So I can enter charges for those, which are actual no charges because they would be included in her delivery since we're billing global. So she was post dates at 41 weeks. Looks like they had placed a Cook catheter to help dilate her cervix. But all this is documented by the resident, and I don't have an attestation by the provider saying that he or she agrees with the documentation. So unfortunately, we cannot bill for that Cook cath. She had elevated blood pressures. For that, I used the 026893 with the R03.0 code. And then we have another stop here in the patient's room so that we see, make sure nothing changed. Okay, that all looks the same. Let's see the H&P note. Okay, it's by the same provider and resident. And here she actually has an attestation. It says resident participated in the evaluation, management, and treatment of this patient. I reviewed the history, examined the patient, approved the orders, discussed the medical decision-making and patient's condition and management with the resident and patient. I agree with the resident's plan of care. See resident's note for review of systems, HPI, and exam. So now I can bill for that Cook catheter because they mention it in the H&P here and she agreed to it. So for that, we bill the 59200. I'm going to put a GC modifier on there since she is working with resident. And then my diagnosis code looks like it's going to be that late term pregnancy, the 0480 with Z3A41. Let me see if I see anything else here. I'm not seeing anything. So my camera just cut off, and I'm not even sure how much you guys got, but I'm on to office procedures right now. So if you guys didn't get to hear both of those deliveries, I'm so sorry. I don't know why my phone cut off. But right now I'm looking at a Nexplanon insertion in the office. So I'm just gonna pull up that note and read over the documentation. So there was 7 stitches made, preloaded, trocar was placed subdermally, Nexplanon was inserted, and trocar was removed. So everything looks good here. My code for the Nexplanon is J7307, and insertion code is 11981. My diagnosis code is Z30.017. The procedure I had prior to this was a Nexplanon removal and reinsertion. So that code was the 11983. And it looks like I have another one here. And it's going to be the same HCPCS code, J7307. My diagnosis code will change. It's going to be the Z30.46 now. So let me take a look at the documentation. All right, removal of drug implant device and insertion of a new one. Patient's left inner arm was prepped. Small incision made along this side of the Nexplanon. Nexplanon removed intact without difficulty and shown to the patient. A new Nexplanon placed via removal site without difficulty. So again, 11983 and J7307. I'm gonna head and finish that one. And then it looks like we have an IUD insertion for the Kyleena device. They also did a urine pregnancy test, so I'm just gonna take a look here. I'm pretty sure it was negative. Yep, it says it was negative. So Z32.02 for that 81025 code. And then here is my documentation for the insertion. Everything looks good, so I'm gonna go ahead and submit this one. Next, I have a what is this? Nexplanon removal. So let's see here. They made a small stab incision and Nexplanon removed intact without difficulty and shown to the patient. So that code is the Z3046 as well. Let's see what's next here. We have a colposcopy. So let's see what they did with that scope. We have speculum placed in the vagina with excellent visualization of the cervix achieved under colposcopic examination. Cervix was swabbed ×2 with acetic acid solution. Looks like they're going to do cervical biopsy and ECC. The ECC was done with the ECC brush, and they did a cervical biopsy punch. So let me take a look at pathology. Here. And it says chronic cervicitis. That's it. Okay. So that's the N72. That'll be my third diagnosis code. I'm going to keep the other codes that was the reason for the CULP, which was the ASCUS with positive high-risk HPV cervical. So my codes are R87610 and R87810, as well as N72. And my CPT code is 57454. Alrighty. I have a prenatal visit, and the patient does not have insurance, so we would not be submitting the global code for that. We bill an E&M, so I need to look at the documentation here, which I'm sure it's just going to be a 99212. Presenting for routine prenatal, reports normal fetal movement, denies contractions, no vaginal bleeding or change in discharge or leakage of fluid, low back pain, discussed heating pads. Yeah, that's a 99212. And then this is her second pregnancy, so Z3482. And that one is good to go. All right, let's see here. What else can we do? I have a circumcision on a newborn, so let's look at that one. They use the Gamaco clamp for the circumcision, no complications. 54150, and then my diagnosis, they already have the Z3800 or Z3800, but I'm going to add Z41.2 and link both of those and just put that I reviewed that procedure. Okay, here goes some outpatient surgery, so let's take a look at those. All right, so we have an outpatient procedure, and it's going to be a laparoscopic bilateral self-injectomy for sterilization. That diagnosis is Z30.2. Our CPT codes are going to be 58661. I'm going to bill that twice with modifier 50 on both lines and GC on both lines since there is a resident involved. And let's take a look at the documentation. Okay, yep, everything's good. Got my diagnosis, my CPT. Sorry, you guys, my camera cut off again. So I'm just going to end the video here. I tried to get us to 20 minutes, but unfortunately we are not gonna make it. I even went in and checked to see if I had any denials in my follow-up work queue, and I did not. I have one in there, but that's something that the office needs to review for a vaccine. I don't review vaccines. But yeah, unfortunately, I really don't have much else. It's starting to get a little repetitive. So I'm going to continue to work, but we're going to cut the video here, and I will see you all in my next video. Bye, guys.